Hi everyone, my name is Sam Lin. I'm a plastic surgeon and associate professor at Harvard Medical School. I perform surgery and take care of patients routinely. I also have a research team with national and also international research fellows comprised of medical students, of residents in training, as well as postgraduate physicians who work side by side with our students. I also teach medical students from near and far, residents and fellows in our training programs. And so I'm here to speak to you about our virtual telehealth rotation with AM opportunities, and it's been great. The pandemic certainly has affected all of us, and however, a positive thing that happened was that it opened up an opportunity. The virtual telehealth rotations were formed in the springtime of 2020 and have been going strong ever since. Telehealth is certainly, with internet, a global information highway, and telehealth is certainly widely available and accessible to many, many people around the world. The advantages of telehealth are certainly that it can save on cost, time, effort, and travel, while at the same time being able to spend significant amounts of time with students on average on a daily basis that I otherwise wouldn't have been able to on an in-person rotation. So I've really found that the telehealth rotations, from my perspective, in terms of being able to spend time with students, has been much more in terms of the time spent daily on a weekly basis. And of course, the letter of recommendation is still earned and possible with telehealth rotations, and even more so since telehealth obviates the need for travel. And so how does the course work? I can take up to 8 students at a time or even more. It is a 4-week course with essentially a few components. One is a self-study course during the daytime through the Scientific American Plastic Surgery Virtual Curriculum, of which I am one of the current editors for the Plastic Surgery Virtual Textbook through the platform. It's comprised of reading material, of chapters, of videos that are surgically based, as well as a daily assessment and quizzes on reading material on a daily basis. During the evening time, it's then comprised of daily meetings and lectures that are nationally based, as well as surgeries that I narrate with the students and answer questions continually on the daily meetings that we have during the evening time on each week for a 4-week basis. So it really works out in terms of providing a wide scope and breadth of plastic surgery that otherwise you might not see on an in-person rotation. So recently we were able to put together a specific research rotation for the students as well. It is an AMO Research Rotation looking at a 1-month course on the basics of learning how to perform a systematic review. And this is a type of paper that looks at previously published papers, so does not require an internal IRB. It can be a topic on any field specifically that the student is interested in applying for, and the goal of which is to be able to put together a paper for submission to a journal at the end of the process. I know that 1 month is really not enough time to be able to put a paper together for submission, so it's really getting people started in the process of understanding how it is to put together this type of paper, which is a systematic review on a topic using guidelines such as Prospero and registering things to the Prospero as well as PRISMA guidelines in order to put together this type of review. Now I want to switch gears a little bit and talk about a group that I've been able to help called IMG Match. And IMG Match is a coaching mentoring group that's been able to help IMGs apply and match within U.S. residencies, and I think it's a great group of folks that have a unique perspective of being able to help people during their journey in applying to U.S. residency. There are many sides of an application. There's the mentoring piece, coaching and mentoring piece that IMG Match provides. There is the rotational aspect of experience, both virtual and in person, that AM Opportunities provides. And of course, there's the academic process of learning and reading that only an applicant can do on their own. And so, but I think it is always possible, and depending on your interest and your field, to be able to realize your hopes and dreams. And again, our IMG Match group focuses on the mentoring and coaching aspect. We do give advice to each and every step of the process: application, interviews, test taking, rotations. We want people to be successful, of course, in their match process, and achieve that through the match process or the SOAP process if need be. We have people who reapply from previous years who we've seen or not seen, and sometimes many years previously who have applied. Helping with people's direction and which way they want to go is a rewarding and important aspect of what we do to provide life guidance. Coaching, as we've mentioned, is over a period of really weeks to months. It's a very relatively brief, sort of several months time, or it could be up to a year or longer, but really fruitful, I think, in terms of providing that benefit to people. There's constant support from us. We do want people to really do well and just match, and realize that their goals have to be, of course, realistic as well. We help people with that. U.S. residency match and certain specialties are already competitive enough even for U.S. medical graduates, and so it's very important to really have everything in line and goals aligned so that we can all achieve success, and success for the applicant. And of course, the goal of that is to have people go into training that they wish, and to be able to strategize what that training module would be, or field would be, or narrowing their choice of fields into what they're applying. Motivation comes from within, and wanting to succeed, we want to provide that coaching throughout the entire process. And so it's really that IMG Match is a residency platform for coaching and mentoring for international medical graduates, created by international medical graduates. I think this is really a unique piece that sets IMG Match apart from everything else out there, and the IMG Match people really have already walked the walk, so they can talk the talk and know all the visa requirements, and which places might be a little more apt to be able to match IMG graduates. IMG Match is made up of a really dedicated group of individuals who want to help pave the path for your success. And they are at different institutions within the U.S. And from soup to nuts, the IMG Match group provides services such as CV, resume editing, personal statement editing, research manuscript editing, on up to application and interview preparation, residency consultations, and more engaged or time-based follow-up through email support, Zoom meetings, corrections and editing of statements, the application process, the interview prep process, on out through the match. So it's a fairly comprehensive set of offerings that IMG offers. And I would also say that there is a recent edition of Step 1 preparation that the IMG Match group has partnered with respect to helping folks do as well as they can on Step 1. The IMG Match group provides mentors based on the country of origin and also the field of choice, matching the international medical profession for a tailored experience. And it's based on the desired specialty that the applicant or the student wishes to apply for. And throughout this process, we make the IMG Match group matches these individuals for best fit as they go throughout the whole process of the application season. And it becomes a bigger network of mentorship, of research, and also clinical experience. AM Opportunities has been a wonderful partner to IMG Match during this whole process. And so I urge you to consider IMG Match during your process of applications during this season or future seasons. So as we bring it all together in terms of challenges in this day and age, in this season, now that we're coming out of the pandemic, hopefully, although I think it's going to be here to stay in some respects for a long time. As I mentioned previously, step 1 is now pass-fail. So although this is great for certain students, it may not be the best news for other students. And that step 1, again, was a point of being able to show off one's ability to really put in effort and do well on the test. But now it's pass-fail. And so that ability to shine, at least in this aspect, is a little bit different now. So, of course, you need to put in the effort to pass. And the numerical scores for step 2 still remain in place, but they may or may not correlate as well. Observerships have started to open up, but not fully, and several are still virtual. This application cycle this year is still virtual for 2022 and 2023, and that's based on abilities of people to be able to travel, the cost of travel, what have you. However, from the program standpoint, a virtual interview never will supplant an in-person interview for sure. So those are limitations. But I think a virtual learning cycle certainly is here to stay, and I think it's a robust way of getting to know mentors, earning letters of recommendation, and of course understanding and learning more of the cycle of the process to be able to apply. So there are always going to be challenges, but IMG Match and AM Opportunities are here to continue to help you realize your dreams wherever they might be.
How do you think PDs will compare and contrast a pass-fail versus a numerical score for step 1?
Yeah, so for a while we're going to still see both step 1 scores and pass-fail scores for sure. They'll be intermixed and intermingled with different applications. Clearly, that's one more data point, in terms of the numerical score. But of course, everything else is going to be more important in terms of letters of recommendation, research opportunities, rotations, grades, medical school. All those things are going to become more important. But people will still, I think, programs will look at all applicants holistically and try to make a determination what it seems right for each program in whatever field that happens to be. And but I would at this point not delay and move forward to trying to take your step 1, and if it's possible, maybe step 2, since there is still a numerical score with that, although I'm sure in only a matter of time before that becomes pass-fail as well.
Thank you. So the second question, how long does virtual rotations, how long do you think they're going to play a role since the pandemic is almost ending?
Sure. Well, I guess that depends on who you talk to in terms of the pandemic ending. There are still people getting sick for sure, but a lot different than it was 2 years ago. I think virtual rotations are here to stay. They're clearly very convenient. They're cheaper, less expensive for applicants, of course. And I think there's just going to always be a role for it. 1 second here. And it allows a way of being able to earn a letter of recommendation, obviously. Not the same an in-person rotation, but I think the goals of a virtual rotation versus an in-person rotation are a little bit different. You know, the in-person rotation, you're really seeing how the whole hospital works, how the team works, how different cultures at different places end up being. The virtual option I find to be pretty unique in terms of being able to get to know people a little bit more, and in terms of at least the way that mine is set up. And so whereas an in-person rotation, I may not see a rotator every single day, certainly not for the amount of time that I spend. So they're both different. They have both different fields and different ways that are structurally they're set up as well. But I think they'll be here for good.
Yes, thank you. And then what would you say is the best way to prepare for your the research opportunity with you?
Right. So the research opportunity is, I thought about it for a while, and Alicia notes we went back and forth, talked about different options, wanted to set up something that was meaningful for people, meaningful in a way that was, regardless of the field that you wanted to go into, that you could actually do. And so I think all of that has been crystallized with what we have in terms of setting it up as a systemic review month to understand how to perform a systemic review. And that can be applicable for any field. It doesn't have to be surgery or plastic surgery. It can be any field that you are interested in, and being able to design a systematic review and really the steps that go into what that means for a person doing that kind of research. I tell the students that it's not going to be done in the first month for sure, but clearly it can be done over a period of time after the month to get things started, get people started. I also sort of recommend people to have other co-authors to help with the product as well. So overall, I think it's worked pretty smoothly. We've been doing it for a while now.
Yes, it's one of our most popular research opportunities. So I would definitely recommend it. One of the other questions, what kind of opportunities do you think international medical graduates should look for with no previous USCE?
Well, I would partner with clearly with AM opportunities for clinical opportunities and research, or clinical opportunities and experiences in your chosen field. I think those are the main things of, I think, what AMO really does extremely well in terms of providing opportunities for folks and really learning about different fields to see if those are the things that you want to go into.
Wonderful. Does experience as a research assistant account for a lot on a profile?
It can. It depends on what you've done with that experience. Like anything else, it's really delving into what experience that you have had and the track record, how long people have been doing it. So just by listing it, like anything else, just by listing something on the CV doesn't necessarily mean that that's, it could have been just for a month or something. And so it just means on what you've done with it and how it's shaped you, how you are in terms of the person that you are as you're applying for a residency and putting your application together.
We have another question. Does any letter of recommendation from European clinics or doctors improve our chances for being accepted as a U.S. resident in the United States as a medical doctor, or is it mandatory to obtain letters of recommendation from U.S. health system from the U.S. health system?
Yeah, I mean, it always helps, I think, to have people write letters that the programs would know, of course, and that might be in the U.S. But there are certainly prominent people in different fields around the world and in Europe whose letters and words are meaningful. So it wouldn't be that I would only focus on the U.S. Just again, depending on the field, situation, the person, how long they've worked with the person, so they can really comment on the person's character. I would, much rather see someone who's worked with someone for a long period of time and knows them really well than someone who's well known and has barely worked with them.
Thank you. One of the questions was, can you please expand a little bit more on your the non-research virtual rotation? So I guess
Sure.
maybe provide like a day, the outline of the everything that you go over during the month.
Yes. So it's really a course in plastic surgery. It delves into a platform of reading and quiz material that I helped produce and write for about 2 to 4 hours during the daytime. And then later on in the late afternoon, early evening or evening, depending on people's time zones, is what ends up being where we land that time slot, is an additional half hour to 45 minutes every day for the weekdays for 4 weeks, where I go over additional material and talk about different cases and really solidify each day's theme. And we've got a schedule that has a different aspect of the field that we go over every day. And so I think it works pretty smoothly, and I think people get a lot out of it.
And I think I have one more question. Someone had commented, I know a fair number of IMGs are older and have prior professional experience before medical school, a registered nurse or something similar to that. Can you please speak a little bit more to the benefits and drawbacks of being a little bit older and being a professional when applying for residency?
Yeah, I know it can be a stressful situation if folks that graduated from medical school a number of years ago, for sure. It's not the sort of end-all, be-all, of course. And so if you've been out not in the medical world practicing or doing something else and want to get back in, I would encourage you to do that and talk to folks at AMO to see what type of opportunities are possible. My colleagues over at IMG Match, who are all IMG graduates and Match in the US, have that unique perspective of being able to help people, coach people along the way. So, and this is with sometimes people who've graduated from school a decade prior to matching. So it can be a challenge, certainly, but folks understand that as well. And there are programs in the U.S. That are more IMG friendly.